Welcome to the first in our series on self-advocacy. This is going to be addressing medical appointments. My name is Stephen Sheard. I am staff at Camp Brainy Ridge, where we work with campers with NF and many other medical conditions. And one of the activities we do is teaching how to advocate for yourself in receiving medical care. Core tenet of this is that empowered patients receive higher quality care. It's very important to be able to work effectively and efficiently with your care team. We need to be able to help our doctor help us. There's three parts to today's presentation. It's broken into treatment goals, issues, updates, and questions, and treatment options and recommendations. The core of decision-making for medical care centers on how you set your treatment goals. It's absolutely vital that your care team know what your goals are. Your care team cannot help you meet your goals unless your care team is aware of what your goals are. You have to decide what matters to you. Goals are unique to each person. Goals can change over the lifespan. Goals inform the decisions you make. Also about the risks that you're willing to take in order to achieve your goals. So some of what to think about when you're setting your goals is, what do you want to get out of treatment? What do you want to achieve in your life? This is something that will change at different points in your life. And finally, what do you need to be happy and satisfied with your life? When we think about what we want to accomplish, there are intrinsic risks. Many treatments can have adverse effects. So what do you want to be certain to avoid in terms of the risks and adverse effects? And again, your doctor can't know what you're willing to risk or tolerate unless you state the outcome you want from treatment. Here are a few samples of different ways of setting treatment goals. This is an example from a 17-year-old. In fact, this young fellow was about to turn 18 in a couple of weeks. His goals were learn to live independently, to engage in the physical activities he enjoys, to work at his job successfully, and he wanted to pursue a career in photography. And the reason preserving vision was in here very specifically is because this is a young fellow who had a optic pathway glioma that had resulted in a partial loss of vision. This is a 21-year-old. This is a young lady who recently graduated from nursing school and was planning to move out and move in with her fiance. So she was really focused on learning to live independently and to move to a new city because she and her fiance were changing locations. This individual was having trouble with pain from plexiform neurofibromas that were interfering with her ability to work and enjoy some of the recreational activities that she liked to do. And she was thinking into the future that she and her fiance did want to have a family. So that was something that was very important to her. This is an example of a 35-year-old. This is somebody who's at a different point in her life. Something to know about this particular situation is this is somebody who had had a bout with breast cancer. And so she was thinking a little bit now differently about how to structure her goals. Goals, if you wish, can be structured into two broad categories. One has to do with longevity and the other with quality of life. So this individual broke those goals down into those two areas. She's very focused on wanting to be there for her family. And that was a very, very high priority for her. Now, she also had some quality of life issues because she was having ongoing pain that interfered in her ability to work and take care of her kids and also to enjoy sports and activities with her kids. So she was very focused on these issues in terms of how she wanted to structure her goals with her team. And as an example of how goals can really change over the lifespan this is an example of a 68-year-old. This individual had had a co-occurring form of blood cancer and had also had a brain tumor that was found as an adult. And so his priorities were different. So in this case, this individual is more focused on quality of life, protecting cognitive function in particular, protecting the other physical abilities. This was this individual's highest priority. And for him, this was more important than extending length of life. And his approach, not that he didn't want to extend his life, but he would prefer treatment approaches that preserved quality of life, and that was more important to him. So the first section of your appointment agenda will be the goals, and the goals are going to drive all of your decisions. The next section is issues, updates, and questions. And this is where you're going to write out a list of the medical issues, symptoms, and side effects that you're experiencing. It's important to focus on what you're seeing this particular provider for, but it's important also to include a holistic view of what's going on with you. The neurofibromatosis involve multiple body systems, and it's important for your providers to know all of what's going on with you, not necessarily just what you're there to see that specific provider for. Sometimes things relate to each other in ways that you're not aware of. And it's best to let your doctor know all of what's going on and let your doctor sort out what is and what isn't relevant. You want to make sure that you write a list of any questions that you have. When you're seeing a provider for the first time, pretty typically you're going to want to give them more information up front so that they know your history and they know what matters to you. When you're seeing an ongoing provider, it's fine to just give updates and changes. Couple of key points is that you know your body best. You know how you feel, you know what's changed, and you know how treatments are making you feel. It's very important to work with your care team so that you both understand your body and what's going on. So here's a few samples of the types of ways of structuring this section about issues, updates, and questions. Again, we're back to this same 17-year-old. And what was going on for this young fellow is he was going to be going in for surgery in a couple of weeks. And he was cooperative. He was planning to do the surgery, but he wasn't quite sure what this surgery was for. And so he had some questions. He wasn't sure whether or not the tumor being removed was a plexiform. This was an abdominal tumor. He had two tumors, and they were only planning to take one out, and he wasn't sure why. He wasn't entirely sure about why this tumor had to come out, although he was cooperating and wanted to get it out. And he wasn't sure whether or not this was a tumor that could recur. This is an example of a very focused, very limited list of questions and updates. And that was all he wanted to focus on because this was going to be a preoperative appointment that he was preparing for. This next example is a bit more detailed. So this is a 42-year-old going in to see his nephrologist for a routine annual appointment. And this one now is broken down a little more broadly. He was touching base with his provider about a number of issues that had come up in the last year. He had recently been diagnosed with a vitamin D deficiency, something that we know is an NF1 related issue. Recently diagnosed with osteopenia. And he has a question here about does he need to be thinking any differently about osteopenia in light of the fact that he has NF1. He also had erythrocytosis, which is too many red blood cells being produced, and possibly related to a congenital heart issue that was in fact an NF1 related issue, but it wasn't clear why he was experiencing this symptom. So he was asking his provider, hey, could this in some way be related to my NF1? And finally, he was talking to his provider about the fact that he was scheduled to have his heart valve replaced. And he wanted to know, was there anything specific to the NF1 that he was going to need to address? The final section is about treatment options and recommendations. This is a section where you want to prepare some questions about the options you have for treatment, if you know in advance what those are going to be. And you're going to want to make sure you leave room to take notes, because this is a lot where you'll be discussing with your provider your options and hopefully be learning a lot that you don't already know. And you're going to want to make sure you keep track of that information. A few key points here. The patient's job in making decisions about treatment is to be clear about your treatment goals, your risk tolerance, and your treatment preferences. It's important for you to learn about your conditions so that you can make good decisions. Remember that it's your responsibility and your right to make the decisions about your care plan. You are the only one who can make treatment decisions. Your doctor's job is to advise and educate you about your health conditions, to consult and make recommendations about your care plan, and to actively engage you in shared decision-making, working together to make good choices. So in this section, you want to make sure that you've informed your doctor about what you're doing now and seek input about what to do next. You're going to want to ask about all treatment options, not just the one that's been recommended. Ask the provider to explain why the recommended option is better than some of the other choices that you might have. Again, you're going to engage actively in making this decision together. That is shared decision making. You'll want to ensure that it's your goals, your risk tolerance, and your preferences that drive the decision about your treatment. Okay, so we're back to this same 17-year-old we talked about before. He's going to be going in for surgery in a couple of weeks. And he just wanted to just touch base to make really sure he understood about why is he doing the surgery, what happens if he doesn't do it, what are the risks of the surgery. He was aware he had heard mentioned something about possible nerve damage and numbness, but he didn't quite know what that meant. So he wanted to make sure he understood better. He wasn't sure how long his recovery period would be. And this was particularly important because he had some plans for the fairly near future about going golfing and doing some skiing. So he wanted to make sure he understood what the directions would be and what the implications of the surgery would be. And this is the 42-year-old. He was scheduled for the heart valve installation, and it was coming up pretty soon. And he just wanted to be sure he understood, was there anything specific to the NF1 that his cardiac surgery team needed to know? He was asking his provider again. He'd recently been diagnosed with osteopenia, and he wanted to be sure he understood what the recommendations from the NF specialist were regarding this issue. He was already taking vitamin D supplements, but he wanted to be sure that the dosing was correct, so he was looking for recommendations. And then just in general, asking his provider about any other recommendations specific to the NF1. The key point when we reach the end of this decision-making process is to collaborate with your provider. Help your doctor help you, and actively engage in shared decision-making. Thank you for listening to today's session. There are some samples available of complete appointment agendas that will be made available to you, and encourage you to use those, take a look at them, and be prepared for your next appointment.